Okay, so we are going to talk about skin tags today. Another name is acrocordon. So what exactly are skin tags? They are benign tumors that form primarily in areas where the skin forms creases, like the neck, underarm, groin area. They can occur on the face, like the eyelids. We see that a lot on eyelids. They are harmless and they're typically painless. Sometimes family history does play a role. You can kind of see this patient here with some on the neck. This is probably the underarm. We see a lot of these on the underarm. They are equal in prevalence in males and females. You usually get more of them as we age. Usually after their 50s, you could probably see more of those. As many as 59% of persons may have skin tags by the time they're 70. That's how common they are. See the ones on the eyelid, very common, underarm. History and treatment. Sometimes they are linked to type 2 diabetes. They can be removed with scissors. Larger ones can require excision, meaning just shaving them off. Sometimes they need to be cut out depending on how flat and long they are. Electrodesiccation is another way of getting rid of it. We numb it up with lidocaine, we cauterize it. Freezing, I'm not a huge fan of the freezing because you can hyper or hypopigment the skin around the freezing area because the skin tag is literally a little piece of tissue that is like a little light bulb, and then there's a little piece of end that's connected to your skin. So if you freeze it, you may freeze the tissue around it, which causes the pigment changes. Another way of doing it is you can actually hold the skin tag and then maybe use the liquid nitrogen and freeze just the tip, the end where the socket goes into the light bulb to decrease the scarring. There's different skin tags. Basically, they're skin tags. It just goes by sizes, 1 to 2 millimeters, 2 large ones. I think we've seen some of the large ones that are kind of, looks like really like moles that we've seen. Tiny ones are the little skin tags that we saw earlier, you know, around the eyes. Here are some photos of skin tags. Here's some of the larger ones. Look how big they are. This is in the groin area. We see this a lot in a lot of overweight patients. I don't know if you've seen those where if the patient is larger, a lot of it's more from rubbing. Underarm, we see a lot of that in overweight patients in the underarm. Groin area, underarm, neck. They're just benign little bumps, flesh colored usually. They can become irritated. So like if it gets rubbed with the bra, shirt, it can become red. It could be hard from the bleeding. That's it. Easy peasy.